you just don't feel right. And you hear about all this hormonal stuff all over the place. But what if it's happening to you early? How would you know? And could it be a problem? Hi, I am your local OBGYN. I love women and let's talk about it. So we do know that there's this concept of perimenopause, but what does it really mean? It's kind of a crappy diagnosis because we haven't really done enough to define it. And what I mean by that is when we talk about perimenopause, we say, hey, it's when your cycles get irregular, but so many of you know that you had symptoms before that even happened. Then there's a secondary issue of, is this happening to you too early? All right, so we have two things going on. Perimenopause, which is when there's an inside hormonal shift, whether we can pick it up in blood work or in what your periods are doing, and premature ovarian failure, which is when all of this turns off way before it biologically should. So premature ovarian failure is when this starts before the age of 40. When your hormones are insufficient, you're going to get all those same symptoms. As opposed to when you're over 40, we kind of say, hey, perimenopause. Have we done enough studies in this to really say how many happen to one group versus another? No. The reason it matters is because if you have premature ovarian failure, there could be another medical reason that this is happening. Do you have something genetic? Do you have something that is hormonally broken in your axis and system? Do you take a medication? Is there another medical condition that's going on that is turning off your ovaries early? All right, we do get women sometimes as young as their 20s that this can happen to. But the punchline is both kind of get treated the same. We don't have enough to really define perimenopause to say how many are in that in between of premature versus peri, but you really need to get evaluated to make sure there's not some underlying medical condition that's contributing to it.